distal. All right. Every other instrument, you'll either roll in your fingers or you'll have two. So you're going to always tuck on the facial, just like you did with your Explorer to get sub, your probe. We're going to close the face because we want to make it skinny and get the silky back to go sub. So close, tip slightly away, press and pull. First we got to pick our end. Remember, it's a Gracey tipped at 70, so there's only one working edge. So you hold the terminal shank perpendicular to the floor, and the lower edge is your working edge. Okay? So I'm going to tuck it close to the tooth to slide sub, and then open slightly, press, pull. Tuck, open, press, pull. So I'm tucking super gingerly so that it's comfy to slide sub. Open slightly to get 70, press, pull. Once I round the line angle to close, I exaggerate slightly my angle, because remember 70, the blade is already tipped, so it's straight up and down with the shank. So I close about midpoint of the incisal on number 8 or number 9. That's going to close, so I slide sub, then I open, press, pull. Close, open, press, pull. Close, open, press, pull. So if you truly had just a grainy, rough root, you would only insert once, and then you would keep the correct angle as you go around. If I had multiple tenacious bands that I had to pop out, this is when you need to learn how to close, open all the way around the tooth so that you know how to insert every part of the tooth. That's why for checkout, we have you show us how you would close and open on every aspect of the tooth. But there's many, many times where once you close and then open, you just keep that, remain sub, and do your stroke. But for checkout, we want to see that if you had a deposit here, you could close. If you had a deposit here, you could close. Because a lot of times that's a localized spicule. So we're going to have you close, open, press, pull. Close super gingerly, slide sub, open slightly to 70. Oh, I'm so sorry, don't do that. Close, open, press, pull. Close, open, press, pull. Close, open, press and pull. Okay? So and you're going to do your nears and fars on your lower anterior. So you have to pick your end again. So hold the terminal shank up and down. See which side's lower. This one's lower, follow it to the tooth. So that would be my near, so I know I need the other end to do my far. The other way you can check, especially if you're on the mandible, if you have the incorrect working end, the face is wide open. Like you can see the whole top of that face of the instrument. So if you're seeing a lot of the face, you start to question. So I'm going to tuck. You might have to come around just a little bit to use less of the tip because it's a skinny tooth. Tuck, open, press, pull. Tuck, open, press, pull. So I'm tucking so that I can slide sub comfortably, open, press, pull. Tuck super gingerly, slide sub, open to 70, press, pull. Tuck, it's a tiny little tuck, open, press, pull. So for these front teeth that are so skinny, it's like a sliding board kind of angle. You're not going straight at the midpoint because you have too much width of instrument. You're going to impinge on tissue. So sometimes you need to tuck it at an angle as well, or slant it at an angle and use less of the instrument down at the gingival margin. So close, open, press, pull. Close, open, press, pull. Close, open, press, pull.